people showing up.
I know. Well, when you walked in.
Yeah, I'm trying to do for lines. I don't do lines in general and all that. You know, it's look, I know, you know.
I get it. That's why I had to tell you I was just messing with you.
Usual routine. Right.
Okay, he's got his X-wings coming in. And we're like, oh my God! Are you back on?
Oh, and it is moved down. Look how far away it is.
What's up? Good, man.
What's that
How
dude?
you doing?
I like that color. I need some shoes that
Oh,
color.
looks pretty cool. Stylish.
I know. I actually wore these shoes for you today.
I love those shoes.
Yeah.
This color and this chicken.
Yeah, it's like once winter comes, I don't know. Wow.
Well, maybe, I don't know. But those my favorite color.
I know.
Killing it.
Trying to.
Are you ready?
No.
I think we're going to do it on
Chuck already tried to surprise us with that.
hour and then you're here. Don't worry about it.
Is it still?
I hope you're ready.
Is it giving you problems?
Hey, do this real quick.
Right.
Let's say I'm gonna go listen to it. Will you just hold it like over here somewhere? Right. Let's see if that's what it is. Oh yeah. Do that again.
I can't see.
Just move it around back.
Woo!
Whoa.
Hear that? That's what I'm doing.
What about down here?
Yeah, it's like real faint right now, but it's like wanting to.
Rob.
But it wants to.
What is that? I
Can
bet
we
it's
make
my
it-
crappy old
we
1987
make- okay.
Microsonic Cube here.
I'm gonna do the old turn it off and turn it on again.
I can't imagine they're that close in frequency.
Showing us all how it's done.
Why? No, I get why you're over it. I'm saying why. Why did they do that to you? Not doing it right now.
Okay.
Weird?
Yes, it is.
I said,
Well,
soon.
soon.
I said,
We will be using
yeah, I
this.
don't use that.
They'll have microphones.
did our Shriners thing.
I hope-
Raise money.
I just hope it can pick up Dr. Beach.
So like you got two mics, is that like one for the web and then one for something else or what? Or for the camera maybe or something?
Hers broadcasts via Facebook.
One for you? Everybody gets
And
one?
mine goes to.
There's another one.
Yeah. Mine goes to YouTube. And it's also backup in case
In case we have some technical issues.
this cuts out, that
Right.
we have, yeah.
Little redundancy.
I
there.
know, and we have tried to feed my camera through the laptop to the broadcast system, and we stumped all the IT, and you know, it made me feel a little better, right? It should work, and then that's what I was saying, and then you hear you guys say it should work. So thank you. I feel better.
Technically, it should work.
Yeah.
Technically.
Theoretically, it should perform.
In theory, everything works.
Everything would work. Right.
Hey,
1 minute warning.
1 minute, hi.
1 minute warning.
Everybody set up?
Pretty much real broadcast.
Wednesday. I was gonna say, that's a Monday
Oh,
side.
no, it's only Wednesday.
When's first frost? Does anybody know?
It was Monday.
Yeah.
Okay.
I had to get my eyes for it.
Okay. Can you hear me? Yes?
Ready?
Yes. Good morning. Today, I want to give an update and offer some clarification on the county's response to this pandemic. The federal government awarded $173.5 million of CARES Act fund to St. Louis County soon after the first case of COVID-19 was reported in St. Louis County. Before the money arrived, we had dozens of meetings to determine the proper way to use these funds for our residents. We decided to focus on three key areas. First, to protect the health and safety of our residents. Second, to look out for their basic needs. And third, to focus on the economic recovery. The commitment was made that the money would go to those who needed it the most. And we would need to partner with agencies who were deeply rooted in our community and knew how to reach our most vulnerable residents. And that's exactly what we've done. There was not a blueprint, and initially, there was not much guidance. But we knew that we would be working with a diverse group of partners, including business leaders, medical community, community activists, educators, and small businesses. So how do we use the money to have the greatest impact? That was a question that we asked ourselves over and over. So one of the first programs we began was a small business relief program. So while working to purchase PPE, to provide testing in our community, and to establish guidelines to keep our community safe, we knew that there would be a toll on our small businesses. The small business relief program that we've established has now awarded 1,600 grants to small businesses in our community, and they've been approved by our county council. The program has awarded over $19 million to small businesses. 2/3 of our county residents live in 88 municipalities, and these towns have also been hit hard by the pandemic. Last month, we announced the Municipal Relief Program, and this has set aside up to $47 million to provide grants to our municipalities. 2 weeks ago, the Office of Inspector General clarified the reporting requirements for what this federal agency calls prime recipients of this federal grant, like St. Louis County. The new federal requirements simplify reporting for expenditures for public safety workers and public health workers. With the new guidelines in place, we have extended the application deadline to the Municipal Relief Program to this Friday. I'm proud of the hard work of our county employees as well. More than 50 people have come together to work on this incredible, vital responsibility of getting these funds into the hands of the people who need them the most. While we have a short window to have this money obligated, we can't afford to take any shortcuts. We've had to design programs from scratch. We've had to hire a third-party administrator to make sure the applications were proper. And we've asked county employees to arrange their already busy workloads during this COVID-19 pandemic to ensure that the CARES Act funds are spent properly and effectively. The employees working beside temporary employees and volunteers have been patient, and they've stepped up to every challenge along the way. We have until December 31st to have all these funds obligated, and we have until March 31st to have all the funds out the door, and that's what we'll do. I wish we had more money, but recovery is going to be a slow process, especially as this virus continues to spread in our community and in our country. We are grateful that these federal funds were made available, though, for our residents and also to help our small businesses. This has been an incredibly tough time. We've also committed $3 million to PPE to help support our schools to get back to an in-person learning opportunity. This money was distributed to those hit hardest by the pandemic, including 17 zip codes in North St. Louis County and 1 zip code in Southeast St. Louis County. We've also worked with the county library system to spend $4 million on Chromebooks and hotspots for students who need them the most, as determined by our school districts. We're also extending contracts to our partners in the community for food distribution that will continue throughout the end of the year. And on top of all this, we continue to make testing widely available. We are now testing over 3,000 county residents every day. And today at 5 p.m., our businesses will move from a 25% capacity to to a 50% capacity as determined by the fire code. And in many places across St. Louis County, this Friday, football will be played. This is a work in progress. The rest of our community is coming together to comply with our mask mandate, with our social distancing guidelines, and that's what has allowed us to make these changes and improve our public health orders in St. Louis County. This shows our resilience. This shows our willingness to work together as a community to keep our residents safe. Let's keep it up. Thank you, and I'd be glad to answer any questions.
You mentioned football starts this Friday, and I know Monday you spoke about how athletic departments need to turn in a safety plan to the county health department. How many schools in the county have begun to do that or submitted anything?
Well, high school football will be played in some places, some schools this Friday. We've been working with all of our advisory groups, all of our business sectors, and all of our affected institutions to develop plans. We've been working with our athletic directors for several weeks, actually several months, on high school sports, and they've been working on their guidelines along the way. Many of those athletic directors submitted their guidelines on Monday, and they're in the process of being reviewed. And I would expect that some of them have already been approved, but that process is ongoing in the county health department.
And I know we're seeing an example in St. Charles County where one school has 500 students quarantined.
Yes.
I know you recommended, not mandated, but recommended that students go back to in-class learning. What's the county's plan, if a situation like that were to arise?
Well, we're working very closely with our superintendents. We have, with our public health department, we have weekly meetings with our superintendent leaders, and we're providing them with guidance. But all of our schools have a plan for isolation and quarantine when someone tests positive, either a teacher or staff members. We've seen those plans unfold in other counties that have in-classroom learning now, and we will have similar plans in St. Louis County. But our school districts have been working on those plans. They have them in place, and they will implement them whenever they're necessary.
And my last question, I know federal funding may be tight coming down the pipe, so to speak. I know you mentioned yourself, you wish you had more money for municipalities, for small businesses. I'm sure even more money for school districts and PPE. Is there a plan in place maybe, or have you guys re-looked at the budget just to know that we might have to stretch these dollars out a little bit further than we otherwise might have thought?
We're watching these needs very closely, and we believe that our priorities, protecting the health and welfare of the residents, taking care of our basic needs, and then the economic recovery, we believe that those are in the right place, and that the process to award grants is appropriate. But we do have to spend this money by the end of the year. We're on the trajectory to do that. We believe that we've taken the right pace. We've committed about half of the funds so far, and over 25% of the funds have already been distributed. The checks are already out the door, and we'll continue to do that. But we believe we're on the right trajectory to commit the funds by the end of the year, as required by federal law. We hope that there's more funds available. We know that the President announced yesterday that there would be no further negotiations on another federal stimulus grant until after the election. So we hope that starts up again soon, because we know that there are many needs in our community, and we do not want the economy to falter.
Now, that's kind of a tug of war when it comes to those federal dollars, the CARES Act. Last night, obviously, the council voted 6-1 to kind of snatch that control, I guess, when it comes to spending those funds. Sitting on your desk, or could potentially be sitting on your desk, what do you plan to do with that bill?
Well, that bill doesn't change anything that's currently happening. The funds have been appropriated. We will continue to spend them on our priorities. We will continue to report to the Council Oversight Committee about how those funds are being spent, and we will continue to work with council members who have advice for us on programming and how to distribute those funds to the people who need them the most. What that bill does is it says that if there's any future grant or any future money coming from the federal government, that we will go back to the council for appropriation authority. And I think that's appropriate. I don't have a problem with that.
With businesses, increasing their, occupancy to 50%, some schools, considering in-person learning, and how are the hospital systems faring? I know a lot of the rural areas, we're seeing spikes, and I was spilling over into our hospital system, so how is that looking right now?
The hospitals are busy. It's steady. We had a pandemic task force meeting yesterday, and many of the patients coming into our St. Louis County hospitals are coming from outlying areas, from other counties. And we're happy to take care of those patients. That's a service that St. Louis County has provided for decades, to be a referral center for people who are sick from other parts of the state. But we believe that the hospital capacity, although it is steady, does not reflect a trend in St. Louis County that is currently alarming to us. And we watch the testing numbers, the positivity rates, the new developments in treating COVID, the progress on the vaccine, and we watch the hospital admission numbers, and we watch the ICU admission numbers as well. But that hospital admission number needs to be taken also with the understanding that a lot of those patients coming in now are not from St. Louis County.
Are there any plans in place, should overcrowding happen, since those rural area people are coming, and then we're kind of loosening the guidelines in St. Louis County? Are there any plans for overcrowding, if that would happen?
Well, St. Louis County right now is doing very well. Our positivity rate is below 5%, which is a very good place to be. It's steady. The masking and social distancing acceptance by our community is strong. And as long as that continues, as long as people continue masking and continue our social distancing guidelines, we'll continue this trend. I think we'll stay steady, probably similar to where we are. We may drop a little bit, we may go up a little bit. We represent 1/6 of the state, 1 million people, and if we can keep the virus in check, if we can manage the spread of this virus in our community in a controlled way, then I believe we'll make it through the next several months and get to the summer when a vaccine is widely available.
Dr. Page, can you talk to those business owners who say, obviously with this occupancy kind of being elevated to 50% now, they said it was 25%, they only had 25 people in their business. With this 50, now it's 40, still below what they, can. They said they're struggling. Talk to those business owners.
Well, I think what we're seeing actually is that, some retail had lines, most of them didn't, because folks were still nervous about going out. Some restaurants had lines. Many of the restaurant businesses converted to takeout. We hope that we will see more commerce and more traffic in our businesses, but really the rate limiting step to get more people out and shopping and get more people into restaurants is consumer confidence. When they walk into a business, do they feel safe? Do they feel like everyone's wearing a mask? Do they feel like the procedures in place are keeping them safe? And when patrons of businesses feel safe, then they will spend more time shopping in retail, and they will spend more time in restaurants. Until then, I think we're going to continue to see a lot of carry-out traffic because some people just aren't ready. And as we get even greater, we still have a small portion of our population that are in St. Louis County, a small group that are resistant to our masking order, but that group gets smaller every day. There are certainly some politics around that, but when people know someone in their family who became sick, or know someone who is their friend who has a family member who became sick, then they're much more accepting of our masking guidelines.
Going back on Blair's point, I know St. Louis County has had tighter restrictions compared to some of the other places in our metro area. I know you say you take pride in, St. Louis County Hospital being a referral center, but does it frustrate you to some degree to know that you have to foot the bill even though you're trying to do the right thing as opposed to some other areas are a little bit looser?
Well, St. Louis County residents have made a lot of sacrifices over the past 7 months. And we understand that. But those sacrifices have put us in a much better place today and will keep us in a better spot moving forward. And as much as it has been frustrating to watch other places of the country or other places of the state have less restrictions, I believe that frustration will fade as we see that we are in a better spot, and we will stay in a better spot moving forward through the winter. And the winter will be very challenging for our community and will be very challenging for our country. As far as footing the bill, you know, that's what we do in St. Louis County. We have, you know, 20% of the jobs in the state. People come into St. Louis County to work. They come into St. Louis County to do business. We benefit from that economic activity, and you know, there's a trade-off. Our hospitals have always taken care of people from all over the state, and we will continue to do that.
And flu shots, I know you've been a big advocate for it. Have you seen a lot of people coming in and a lot of good participation?
No, we haven't seen, well, the flu, it isn't time yet for the flu to really kick off.
I mean, just people getting the shots.
Oh, right, yeah. I think we'll have a wider uptake of flu shots this season. I think we'll have more people getting immunized this year than we do. It's a little bit challenging because folks may have to go to a non-traditional source to get a flu shot. They may have to go to a public health department, and anyone who wants to go to our website, stlcorona.com, can make an appointment for a drive-through flu shot at either of our North or South County public health locations. And then there are many pharmacies around town that provide the flu shot, and employers who generally would provide a flu shot at work, they're making arrangements to have their employees immunized who are working virtually. Any questions? Doug, anything?
No, I can give you guys, there's been 5 school districts approved, and there's 10 others that are currently under review.
So 5 school districts have been approved for high contact high school sports, which were the highest risk, so they were held longer than the other youth sports, and then the other plans are in progress.
When you have a contact tracing effort, because I know that's a big part of it, when you have an effort that big of it, is it a joint partnership between the school and the county, or is it more the onus on the school?
So one of the requirements of a plan, the requirement for high contact high school sports, the highest risk of the sports for spread of COVID, is to submit a plan, and one of the requirements of that plan is to demonstrate what your contact tracing program is going to look like, because we expect full cooperation from schools and athletic directors on contact tracing. And compliance with that plan is part of the approval, and you know, not being in compliance means your plan will be revoked. We have a lot of partnerships in the community that help us find the path forward to keep people safe and to be as flexible as possible with our public health guidelines across all business sectors, including youth sports. Okay, thank you.